A 30-year-old man came with choking episodes after ingestion of fish bone while eating. The fish bone got impacted at the level of T4 in the esophagus, which is the most likely site of obstruction. So option 1 is left bronchus, option 2 is arch of aorta, option 3 is cricopharyngeus, and option 4 is diaphragm. So they are saying this is impacted at the level of T4 in the esophagus. So you need to know at the level of T4 what all happens. At the level of T4, that means it is at the level, there is the external angle of Lewis. External angle of Lewis. Important thing is T4 vertebra happens at the external angle of Lewis. So at the level of T4, this is a landmark place where following events are occurring. One is the bifurcation of trachea. So bifurcation of trachea means trachea bifurcate, that is known as carina. 1. 2. T4 level is at also at the used for counting of ribs. So counting of ribs is done T4 level, and anteriorly it is this place is known as the sternal angle of Lewis, which articulate with the second rib. Sternal angle of Lewis. So this one and the same thing. Another event. Third event is the division of superior and inferior mediastinum. So mediastinum is divided into superior and inferior mediastinum at this level T4. Fourth event, the thoracic duct turns from right to left. Thoracic duct turns from right to left at this level. At this event, at this T4 level also, this pulmonary trunk also divides. Pulmonary trunk also divides T4. So many, it's a landmark event. Now important thing is that you have to know there are 4 constrictions of esophagus. 4 constrictions of esophagus, and they are taken from the level of incisors. So important thing is first constriction is at the level of, if you remember in inches, 6 inches, 9 inches, 11 inches and 16 inches. So the 6 inches away from the incisor first constriction is known as the cricoesophageal junction. So cricoesophageal junction, I will go and explain on this diagram. Cricoesophageal junction, again C6, and it is 6 inches. So 6 you can remember, or it is also 1 inch is 2.7 centimeters. So 15 centimeters away from the incisor. First constriction of esophagus from incisor. Second constriction is at the 9 inches. So if you go to this arch of aorta start and finishes at the level of T4. So the answer here is arch of aorta. Option 2 is correct. And arch of aorta happens at T4. So T4 is at the level of, you can say, a little bit 22.5 inches. That is exactly 9 inches away. The third constriction is the level of left main bronchus. So third constriction is the level of left main bronchus. It is 11 inches, or in this figure you can see 25 centimeter or 10 inches, 1 inches above and 1 inches below. There are 2 constriction. So 6 inches, 15 centimeter. First constriction, second constriction at the level of T4, 9 inches or equal to 22.5. Third constriction, 11 inches, 27.5. In between is the 25 centimeter is seen in this figure. And the fourth constriction is at the level of 40 centimeter, or it is 16 inches. So that is at the esophageal opening, or the diaphragm is there. So one more thing you need to remember here is that the openings of diaphragm. So there is a mnemonic called as VOA, Voice of America. So at the vena cava opening, V for vena cava opening at the level of T8, O, T10, because O is looks similar to 0 and T10. So 8, 10, 12, these are the vertebral levels. So aortic opening has got 3 structures transmitting from this. This is known as ATA, ATA. One is the arch of aorta. This is another is azygous vein, and T is thoracic duct. So this is what you need to remember. The vertebral levels, 3 esophageal openings, vena cava opening, esophageal opening and aortic hiatus. 8, 10, 12, दो segment नीचे हैं, and the structures which are passing from this. One is the IVC, esophageal. Along with the IVC, I think the phrenic nerve passes with this. So the main crux from this point is the constrictions of esophagus and this diagram which I have shown you. So, and the landmark level of T4, that is the anteriorly, which is known as sternal angle of Lewis, and it is sternal angle of Lewis is used to count the ribs, and it is the second rib which articulates here. So in a lean and thin person, you can count the ribs if you know the sternal angle of Lewis. It is at the level of second rib, and posteriorly it corresponds with the T4 level. So one of the many landmarks of the body, this T4 landmark is very, very important. Now we're coming on to the other question. Second question. A woman present with breast lump associated with skin dimpling and nipple distraction, what is the most likely anatomical structure responsible for skin dimpling? So in this question, options are: one is lactiferous duct, second is suspensory ligament of Cooper, third is pectoral fascia, fourth is subcutaneous fat. So they are asking about the skin dimpling. So the very important clinical aspect, this is known as PUD orange deformity or PUD orange appearance of the breast. So they are asking about the which is the structure responsible for skin dimpling and nipple retraction. Whatever the breast are there, if you see this diagram, this is the diagram which is the firmness of the breast is responsible, is made by the none other than this suspensory ligament of Cooper. In young age, the breast are firm because the suspensory ligament of Cooper, they are proper and they are tightly held. With increasing age, what happens? The suspensory ligament of Cooper gets lax, so the human breast, they become a little bit down and they become lax. Okay, so associated with skin dimpling and what is the most likely? So the answer here is suspensory ligament of Cooper. Other things you can see what is important here. This is the pinkish area. This is known as the nipple, and around the nipple, the areola is a dark area, and the structures which are beneath this, or this all yellow, is the fat tissue, and then they are resting over the pectoralis major muscle. This is just beneath this, all the human breast is resting over the pectoralis major, and beneath this pectoralis minor is the pectoralis minor. Pectoralis minor, actually speaking, this is the key muscle of this region, because key muscle, why it is pectoralis minor is known as PE muscle, because it divides the axillary artery into three parts actually. First part, second part, and third part. First part is before this pectoralis major minor. Second part is behind, and third part is beyond. All are three B. Before pectoralis minor, which is a key muscle. Behind this, the second part, and third part is beyond. And to make it more easy, first part has got one branch, second part has got two branches, and third part has got three branches. So axillary artery is very important. Axillary artery is nothing but the continuation of subclavian artery. And axillary artery continues as brachial artery, and that further divided into radial and ulnar artery. You all know it. So this is about this question. And next question. In the given barium swallow image, which of the following shows the left atrium impression on the esophagus? So this is a X-ray which is telling option 1 none, option B is A, B, and C. So they are asking for the left atrium impression. So C, that answer is the C, because this is at the level of left atrium. B is at the level of left bronchus, and A, you can say it is aortic knuckle. So the answer is C, left atrial impression. You can see this X-ray. So the indentation by the aorta is at the level of A, aortic knuckle. That's very frequently asked in the viva of UG, aortic knuckle. B is left bronchus indentation. Okay, and C is the what is asked in the question is the left atrium. So now coming on to Next question. Which of the following structure passes through the foramen marked by the arrow? So the options are here. One is esophagus, IVC, thoracic duct, and cingulate trunk. So here you can see these are the openings in the diaphragm which you have already discussed. So the arrow is at the level of aorta. We have already seen so aorta. Along with this aorta, what passes is the aorta. Aortic opening transmits thoracic duct and azygous vein as well. So in the option we can see thoracic duct. So this is the answer. Thoracic duct is also passing. Esophageal opening, as we have discussed, it is at the level of O, that is T10. Okay, esophageal opening. IVC is at the V, so is at the level of T8, and aortic opening is at the level of T12. So VOA, remember V, vena cava opening, 8. O is T, esophageal opening, T10. Okay, T10, and aortic opening T12. And along with aortic opening, they transmit azygous vein and aortic opening and thoracic duct as well. So this is the clearly arrows are pointing to the red structure, that is the aorta, that is the great vessel. And to know more about the great vessel, there are two great vessels. One is the IVC and other is the abdominal aorta or the aorta. So IVC is more on the right side. Always remember the venous structures are more on the right side and aorta is on the a little bit on the left side. Now on palpation at this site marked by the red arrow on the image, a bony ridge is felt. What is the vertebral level of the marked arrow? So this bony ridge, whenever you feel in your human body, the bony ridge, when you go and palpate beneath this is the sternal notch or mid-clavicular notch. You go down and you feel inside that arrow is at the level of sternal angle of Lewis. Angle of Lewis or sternal angle of Lewis, which is at the level we have discussed, at the level of T4 vertebra, or which correspond with the second rib. So this landmark is used to count the ribs, and it is also a very landmark. We discussed many things are occurring in the earlier we have discussed what all happens at T4. So the option here is not T2, T3, wrong, and T5, T6 wrong. And now option 1 and 4 are there. T3, T4 intervertebral disc and T4, T5. So actually the answer is T4 and T5 intervertebral disc. So now coming on to the next question. Mark the auscultatory areas of the heart from image given below. The image is clearly telling you A, B, C and D. So A is the aortic area, B is pulmonary area. Here you can clearly put the stato and here this, and C is tricuspid and mitral, D. So auscultatory area A, if you remember, I will make a diagram 1 M T P and A. So mitral area, tricuspid area, pulmonary area and aortic area. Aortic and pulmonary area, right and left second intercostal space. Okay, so there is no confusion on they are what both are at the level of same level, aortic and pulmonary area. Here these are A and B, you can see also at the same level, aortic and pulmonary area. Lower down C correspond to tricuspid area and D correspond to the mitral area. So D is a little bit lower, so D is at the level of fifth intercostal space, and the C is at the tricuspid area is at the level of fourth intercostal space. So it is the option is A1 is aortic, B is pulmonary, C is tricuspid, aortic, pulmonary, tricuspid and mitral. So option B is correct. So how you remember? You remember, you draw from M, T, P and A. A and P are both at the level of second intercostal space, right and left. Mitral is at a little bit lower level, so you say sometimes it's the fifth intercostal space, and tricuspid also at the same level. Some books say at the same level, but we'll say fourth or lower part of or upper part of fifth intercostal space. So this is how it is remembered. M, T, P, M, T, P and A. You go like this. Okay. Now coming on to next question. This is the figure which is clearly showing you aortic area, tricuspid area, M, T, P and A. This remember like this. Both very easy to. Now coming on to the next question. The image shows below shows the cross section of the trachea. Identify the marked structure. So this is your, as you know, the tracheal rings, they are incomplete posteriorly and they're completed posteriorly by none other than the trachealis muscle. So it's a very straightforward question. The arrow they are putting on the posterior side. So this tracheal ring is completed by trachealis muscle. So tracheal rings, they are incomplete posteriorly, completed by posteriorly by trachealis muscle. So trachea, remember, it's an example of hyaline cartilage. Hyaline cartilage is beautifully seen in the slide of trachea. Now we come to this question, identify the arrow mark chamber. So this is the picture which is taken from the above of the heart, and if you can see the two vessels visible, and they are both showing you the tricuspid valve. So all the valves in the body, they are tricuspid. They've got three cusps except the mitral or bicuspid valve. Only mitral valve has got two cusps. Otherwise, every be it the pulmonary valve or the aortic valve, they're all tricuspid. So this one is, these are the two vessels, and the arrow marked is, you can also see a very big vessel, that is the SVC, superior vena cava, and the arrow mark structure is posteriorly. So posteriorly, actually what happens is the structure, only structure which is posteriorly chamber is present is the left atrium. So answer is left atrium. Left atrium is actually is a misnomer. It should be called as posterior. The left atrium is not actually left, it is on the posterior side of the heart, just in the back side of the superior vena cava. This is SVC, this is your left atrium, this is the pulmonary trunk and the aorta. Okay, aorta you can see is more thick. This is aorta. This is aorta because it has got, it's an artery, so it is very thick, and it is an example of elastic artery, and the phenomena of elastic recoil is there. It's a major vessel. It is supplying the blood to the all under very high pressure, and so aorta has to have thick walls as well, and it is also tricuspid. Remember, याद रखने वाली बात यहाँ पर ये कि सारे ही valves, all the valves, they're tricuspid. They've got three cusps except mitral, which is also known as bicuspid. Mitral valve happens only between the left atrium and the left ventricle. So this is clear. This is the same diagram: aortic valve, pulmonary valve, right ventricle, right auricle. Auricle, I will tell, this is nothing but it's an appendages of atrium. Auricle is nothing but the appendages of atrium. Auricle, why they are known as auricle? Because they resemble the ear of dog. Auricle means ear, or the muscle which is in front of the auricle is known as auricularis anteriorly, and posteriorly is known as auricularis posteriorly. So auricle means ear. Here, thing is that it's labeled right atrium. Most of the time the structures which are seen interior of right atrium is asked. So there you can see the chordae tendineae, musculi pectinati, and all those structures. Usually they ask this question, show the interior of the right atrium. But here You can clearly see the left atrium is to be remembered. All the structures are anterior, but the left atrium is located posteriorly. So it is actually, the nomenclature is wrong. Left atrium is not left, it is posteriorly. Left atrium is posterior.